Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about anaphylactic shock. Anaphylaxis is severe allergic reaction that can lead to generalized or systemic allergic reaction, and because of this reaction, if it drops the blood pressure and decreases the tissue perfusion or decreases blood supply to the tissues, it is called anaphylactic shock. What are the causes? The causes are exposure to allergen or antigen, which are foreign materials. The most common food allergies are from cow's milk, eggs, peanuts, soybeans, wheat, fish, shellfish, and sesame. Sometimes latex allergy can lead to anaphylactic shock, or it can be from allergy due to certain medicine. Example, penicillin group of antibiotics, non-steroid anti-inflammatory drugs. Example, aspirin, ibuprofen, from IV contrast or secondary to vaccine. It can be also due to insect bites or stings. Example, bee stings. Now there are two types of reaction that can lead to anaphylactic shock. It is anaphylactic reaction and anaphylactoid reaction. In anaphylactic reaction, when a body is exposed to antigen or allergen, B cells are type of white blood cells. It produces IgE, that is immunoglobulin E. IgE are antibodies. This is called sensitization. Now the body has antibodies if there is an exposure to antigen or allergen. These antibodies bind to mast cells or basophil. This is mast cell. Mast cells and basophil are type of white blood cells, which helps to fight infection. So this antibodies binds to mast cells and basophil. Now they are ready to fight against this antigen or allergen. So if there is a second exposure to this antigen or allergen, this antigen and allergen fights with the antibodies. As a result, histamine is released in the body. The histamine release lead to signs and symptoms of anaphylactic shock. So anaphylactic reaction is also called IgE related. It's because this reaction happens due to the presence of antibodies in our body. It is also called immunological. Now in anaphylactoid reaction, there is no production of antibodies. So antibodies doesn't bind to white blood cells. Instead, exposure to the antigen leads the mast cells and basophil release histamine. As a result, this histamine produces severe signs and symptoms in anaphylactic shock. Even though there are two types of reaction, the signs and symptoms are secondary to the release of histamine. Now let's see the signs and symptoms. So now in the pathophysiology you saw the reaction leads to the release of histamine. Histamine has a systemic effect in the body. So in the blood vessels, it dilates the blood vessel. It's a vasodilator and it causes the blood vessels to leak. As a result, the fluid or plasma in the body leaks to the tissues. That leads to tissue swelling. So it can lead to low blood pressure and interstitial swelling. It is a bronchoconstrictor. That means histamine can narrow the airways. As a result, patient may experience shortness of breath, wheezing. Because of the interstitial swelling or leaky blood vessels, it can lead to swollen lip, tongue, and if larynx is involved, it leads to upper airway obstruction leading to respiratory distress, and it can be fatal. Histamine can increase the contraction of the heart. That leads to increased heart rate. Histamine can increase the contraction of the GI muscle and increases gastric acid production. As a result, patient may experience GI symptoms. Example, nausea, vomiting, diarrhea, abdominal pain. Because of the interstitial swelling, skin, it can lead to swelling, redness, itching, and hives. Now let's see the management of anaphylactic shock. The first line treatment in anaphylactic shock is epinephrine. It is also called adrenaline. Adrenaline is a vasoconstrictor. It narrows the blood vessels. Bronchodilator, it dilates the airway and decreases the swelling. So it is reversing the effect of histamine. Epinephrine can be given IM, sub-Q, or IV. But when a patient comes to emergency department, IM preferred over sub-Q because of its rapid absorption. But if it does not respond or because of severe symptoms, patient may have to get admitted in intensive care unit with IV epinephrine infusion. Other medicines used are antihistamine. It reverses the effect or blocks the release of histamine. Example, Benadryl, or corticosteroids because of its anti-inflammatory properties. Other measures involve administration of oxygen to prevent hypoxia. Airway management. If the patient has stridor or respiratory distress, emergency intubation may become necessary. IV fluids for hydration. And the most important is identify the allergies and teach the patient or avoid exposure to these allergens. If the patient has history of multiple anaphylactic reaction in the past, patient may be prescribed to carry EpiPen at home. EpiPen delivers a dose of epinephrine. At home, patient can self-administer and patient has to call 911 or seek medical help as soon as possible. Now, how to give EpiPen? So EpiPen has two ends with the blue tip and the orange tip. Remember, blue to the sky. So blue towards the up and orange side towards the patient. You have to remove the blue safety cap by pulling straight up. You should not bend or you should not twist. Now place the orange tip in the outer mid thigh of the patient and push down hard. When you push down hard, needle will be injected into the skin, and hold the needle or hold the pen in place for at least 3 seconds to deliver the medicine. Now remove EpiPen and teach the patient to get medical help as soon as possible for the treatment of this anaphylactic shock. So today we learned about anaphylactic shock, and thanks for watching my video.